Myself, Dr. Rajesh Solanki, working as a professor and head Department of Pulmonary Medicine at Nutan Medical College and Research Center and Nutan General Hospital, Visnagar, Gujarat and India. Earlier also I had worked in PJ Medical College since more than 32 years and also taking care in the National TB program for more than about 23 years. So this is my brief introduction. Also, presently I am heading the Vice Chairman National Technical Expert Group, which is formed by the Central TB Division, Government of India. The main concern part that patient having suffering from TB, likely to the family member, always they are worried to keep him in isolation, like put him in a separate room, do not use the common utensil, clothes, towel, everything should be separated. Just like a social stigma that patients should be avoided or isolated. This is totally wrong thing. A patient having pulmonary TB and having sputum positive, ask the patient to have a barrier, like put a surgical mask, or if a female patient can use a dupatta or handkerchief or whatever kind of barrier that will prevent the cough droplet in the air. So my request regarding the do not isolate the patient. The patient having a pulmonary TB, use the face mask or surgical mask to just prevent the droplet coming out of the patient in the air and surrounding atmosphere. This is the main concept of the just to isolate it. Second part is the social stigma. We all know the patient having the TB, usually nobody wants to keep the patient in touch with them, mainly the small children or older people, because they think that if it is contact with the patient, likely to get the infection and most probably they also get the TB, but it is not so. Always try to keep your immunity good, so that even though you are infected, you will not get the disease, because we all know out of 10 infected, only one get the disease. So not always a contact of TB patient will get a disease. This is the two main aspects in the common public that they are finding somewhat wrong conception. Globally, as we all know, once we are talking about the developed country, the chances are quite less, I think less than 1%. But in developing country like in India, Indonesia, China, many countries have got the number of cases quite high. Look at the global picture that India, Russia and China are getting large number of patients, not because of the population, but also they are likely to get some problem in the proper hygienic, poor ventilation, overcrowding, workplace small and many people are working. So these are the something that in a globally developing country will get much more number of TB cases. And as far as the local community, I do agree. If you go to the slums area, you will get large number of patients because all remain in close contact more than one night, or sometimes even we can say, okay, off and on, they come in contact and likely to catch the infection, and later on because of their poor diet or poor hygiene, not get an adequate nutrition, likely to catch the infection and get a disease. So commonly about 85% will get a pulmonary TB, that it will affect the lungs, and remaining 15% will get any organ of the lung, including CNS, kidney, gastrointestinal tract, joints, all part are affected, but they are less in number and they are not infectious at all. But we are talking of the lung TB or TB of respiratory system. Patient usually get the cough for more than 2 weeks, or along with that loss of appetite, loss of weight, quite commonly seen. Some patients may get low-grade fever, and also they are likely to get some lymph node enlargement commonly seen in the neck, what we call it the lymphadenopathy. So these are the main symptoms. Rarely patients may get a pneumotasis or chest pain or shortness of breath can be seen. So basically nowadays we all know there is no any particular community, but yes, I do agree. Mainly the patients who are frequently migrant, or we can say travelers, because of they have underlying lower immunity because of either HIV or some other condition, they are likely to get much more chances of TB disease as compared to general population. Because we know in immunocompromised like HIV or long-term steroid or heavy smokers, they got 10 times higher chances to get a TB disease among infected patients as compared to the general population. So particularly if we are looking care of this migrant population or those likely to have low immunity because of HIV, this group of patients should be screened at least once in a year regarding their symptom screening. If possible, then sputum, then X-rays, that can be done. Even we can go for even nowadays uh, advanced technology like USG for extrapulmonary tuberculosis or CT scan. That depends on the availability of the investigation as well as the patient's condition. So basically, if you ask me my opinion, more than for 34 years, I always ask the patient to take the proper good diet, like healthy diet that commonly we are taking sabji, roti, dal, chawal in the routine diets along with meal. And secondly, to avoid the bad habits like tobacco chewing, tobacco smoking, heavy drinking alcohol. So there should not be any bad habits, proper adequate diet and adequate rest possible. These are the three major things that can prevent you to get a disease because you have to increase your immunity to fight against tuberculosis. Because as we know, if we are healthy, then definitely TB will not be there. Even though we get an infection from the surrounding community, but we are not getting the disease because of our own immunity should be strong enough to fight against the disease.